Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, thank you so much for accommodating us yet again.
Well, thank you for having me on the program.
All right, let's start with what's in the news currently. Could you give us an update on St. Cuthbert's Mission?
Well, St. Cuthbert's Mission, as you know, we had a number of cases there. And we have been monitoring the situation. We have staff on the ground. Today we recorded about 156 positive cases, which came down from what it was just a few days ago. And that's because we have been monitoring people, and once they meet the 10-day asymptomatic deadline, we discharge them. So we're happy that we are making progress in terms of discharges, and we'll continue to monitor the situation. Currently, our medical team, apart from all the persons who are positive of the 156, we're monitoring at least 11 persons who are symptomatic, and we are paying closer attention to them than the asymptomatics because we don't want anything to go wrong with them. But just in case if their conditions worsen, then we'll be able to bring them out to the hospital.
Okay, and just for clarity, you've had no seriously ill person that require transfer to GPHC?
Not yet. And we hope that it remains that way.
Yes. As we're on the regions, Cubana, now there's reported no cases, but I know that you've implemented basically the measures down there to St. Cuthbert, so you're obviously looking at a positive result, meaning better results in this case. Could you guide us through as to what it took from the beginning of the lockdown to where we are now in Cubana?
So we're extremely happy that right now we're not recording any cases, but there are a couple of things that the team would normally do. But I guess the main one is really working with the village council to ensure that the residents of the community comply. If we don't have compliance, then we'll see an escalation of cases. So we have been able to get that compliance, and we feel where people are more compliant with the COVID guidelines, then we're able to actively reduce the cases. In addition to that, of course, we had put in some measures like restriction of movements, and then got a medical team in there to monitor, to do the testing, to help with isolation and so forth. So I think the combination of measures is what helped to quickly reduce the cases. So that's something that we have done not only in Cubana but in other communities. It has been working, and we continue to employ those techniques.
All right. You spoke about compliance being very important, not to pit them against each other or so, but do you find that most of the outer regions, in this case Cubana, and I believe another Tushao from another community, would have also asked for a possible lockdown if it became necessary. But do you think that persons are perhaps understanding the importance of compliance now?
I think once we do the public education pertaining to COVID-19, most responsible leaders would want to abide by the rules. And they want what is best for their community. So yes, once they understand more about the disease, and we identify cases in those communities, we find that most of the leadership are really helpful. So we'll continue to work with them. Even when they don't have cases, we want to continue to work with them so that we can prevent. We prefer to prevent cases rather than to have to deal with people who are positive. But that would be the ideal situation, and we know that we're going to get positive cases, so we have to work in tandem, whether it's prevention, to do more of that so that we can prevent cases from happening, but if we do have cases, to be ready to be able to take the necessary measures to prevent transmission.
Okay, and I know credit for this must go to COVID curve as well, because even though we have not been hearing much of it, this is what basically the group has been implemented to do. Yeah.
Yeah, it's an ongoing exercise, and we are in different communities working with different people. And as I've said before, it doesn't have to take people from, Georgetown to come out into your community. Local leaders, local people with an interest in what is happening with COVID-19 in Guyana can help us by spreading, the word, so to speak, helping with education, talking to people, whether by phone or other means, so as to get people to be more informed and get them to practice the right things. Social distancing, mask wearing, sanitizing your hands. All these look like very simple measures, but they go a long way in preventing and breaking that chain of transmission.
All right, as we're in Region 1, can we have an update on Warpoka?
Well, Warapoka remains pretty much the same. We have had 18 cases, and it has stabilized so far at 18 cases, and we are continuing to monitor what is happening there.
All right, and over in Region 7 for Bartica.
Bartica, we have about 43 cases right now, and most of those cases, well, all of them are in isolation. We have a few that are in institutional isolation, meaning these are facilities that we run, and we have others who are in home isolation. So we have been monitoring those cases for the last week or so, and they remain stable at 43.
All right. Bartica being a mining community and basically an area where people just pass through, do you think that this makes them even more at risk?
Yes, it depends. Well, if you're coming from an area where there've been a hot spot, the possibility is that you can move the infection from that particular location and bring it to this location. So these are things, the dynamics of how people move and where they're coming from. When we do the contact tracing, we are able to pick up some of these dynamics, so to speak, of transmission. And we, as best as possible in those communities, we try to reach out to the people, get them to understand that they might have been in contact or might have been exposed and that they should get tested. And we facilitate the testing. Or in the cases where they are not able to be tested because of their remoteness, is to try to get them to isolate. So these are things that the regional team has been engaged in, and we've been having quite a lot of success stories.
Okay. Can I now ask you about the situation at the schools, the dorm schools?
Well, it basically remained the same. We have identified those students who came into the dorms. We have tested all of them, and we have about 32 positive cases, and they are in isolation, whether it's in our facility or at home, and they'll be continued to monitor. We're monitoring them, and after 10 days, because they're all asymptomatic, so after about 10 days, they should be cleared to return, if they're in home isolation, to return back to the dorm and continue their education.
All right. We've passed, we're just about 5,000 cases, or about past 5,000 cases, and this is overall figures. How many active figures do we have, and basically how is the ministry responding in terms of keeping these low?
Well, 5,000, I think it's 5,005 cases, but most of those persons have already recovered. We've had, I guess, maybe about 4,000 or so persons who have recovered. And we currently have about 700 and something cases that are active around the country. So I think, our rate of recovery has been quite good. our challenge really is that small percentage of people, about 20% or so, who require hospitalization, then a smaller set of people, probably about 4%, who require ICU care. Those who require ICU care, we are providing that care, but those are really critical patients, and unfortunately, a percentage of those we'll lose them. So it is still a challenge, but generally, most of the persons who've had COVID-19 have recovered.
Okay. I know we ask you a lot of the same questions and you graciously answer us. As you mentioned ICU, could we have an update on the Ocean View facility and of course the fact that that ICU is now, well, should be up and running, which adds to what we already have in place?
Yeah, unfortunately, we wanted to get it up and running this week, but unfortunately, there's one piece of equipment that they had to get installed, and that was not installed as yet. So, you know, we'll have to defer moving across our patients by maybe a couple of days. So by next week, I'm hoping to get that up and running. But everything else there is operational. It's just one piece of equipment that we had a little bit of difficulty with. So we're getting that sorted out.
And just for clarity, the hospital is already in use.
Yes, a major part of the hospital is in use. This section that we're talking about is ready for more critical patients, and we want to ensure that everything that is needed for those patients are in place before we move anybody in there. Hence our the ultra caution that we're using to make sure that everything is in place before we move anybody there.
All right, thank you, sir. I know you're busy, so we're going to keep it a little bit shorter today, but I know that there is a media workshop that is planned for today. Just going to ask you, why was that necessary?
With every disease, I think there's a challenge in people understanding maybe the disease and what is happening and signs and symptoms, duration, infectiousness, and a whole host of things that goes with these diseases. And because the media serves as a go-between, so to speak, between the medical professionals, the people who probably have the knowledge, and the general public, the media plays a very important role. So that role includes not just informing people, well, we have had a case here, I had a case there, but I think there's a deeper role, and that is helping the public to understand more about the disease. And so I think this workshop is very important so that we can be able to work with media professionals to get them to understand better about COVID-19. And also, we have seen in other parts of the world, and this has been emphasized by the Director General of WHO, that while we have an ongoing pandemic, because there are some people who peddle misinformation, that misinformation compounds the problem that you have in managing the pandemic. And with social media being readily available to so many people around the world, people can easily post faulty information. So, it's important that media professionals help us to get through that clutter and to provide the Guyanese public in this instance with accurate information that can help them to navigate through this pandemic. And it's an important function that they have to play. And I think so far our media has been, by and large, very responsible in their reporting. So I want to commend them for that, and we hope that whatever we'll be doing in this workshop would assist them in better understanding the disease and how we can together do better for the Guyanese public.
All right. Minister, on that note, I remember when my sister, she's doing her master's in public health, and when we were doing orientation at UWI, one of the lecturers said, don't Google anything and bring it, right? So just like medical professionals, who are some of the most trusted sources in terms of getting medical information that you can recommend for media workers?
Well, there are a number of important sites. So WHO has been providing a lot of information. So there's a special WHO website that deals with the pandemic. So you have stats, current stats, what is available every day from around the world. So like today, if you go on the website, you will see that globally, about 55 million cases of COVID-19, probably 1.3 million deaths around the world. So that's updated every 24 hours. So that would be a very important site to go to. In the US, you have Johns Hopkins University has set up a dashboard where they, on a daily basis, do a similar thing like the WHO, and they're able to put out global stats, and that can be broken down by country, by regions, and that's another important avenue for information. There are also for medical professionals and people who are more medically inclined. You have sites like the Lancet Journal, you have New England Journal of Medicine, to name a few. And these provide a lot of information pertaining to the current clinical trials and so forth that is happening. And then you have a set of information, because for you to get into what is called a peer-reviewed journal, like the Lancet or New England Journal of Medicine, it means that you have to send your article. Other scientists or doctors would have to review it, and that process takes some time. But you now have sites that are specially developed that are called preprints, and that is before it's peer reviewed, it's published on these sites. So you get almost the latest information emanating on these sites. And this site is run by some of the Ivy League universities. They're involved in putting out this information. So whatever is happening in research is quickly available to the public, and you can get that information and utilize it so as to keep the public informed.
Minister Anthony, thank you for your recommendations, and of course, thank you for speaking with us today.
Thank you.
Well, that's it for today's COVID-19 update. We, of course, spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can go on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and, of course, our social media platforms.